Hello everyone. Today I am going to discuss about an important topic for the All India examination. This topic has come in your All India examination many times. This question is asked in All India examination plenty of times. The question is, a 4 years old child has admitted to your hospital with pneumonia. She had similar episode of pneumonia at 4 months and 6 months of age. Her CBC report show that the WBC count is 1,20,000 per DL. Her neutrophil count is 80% and lymphocyte is 19%. Platelet count is 1,04,000 and hemoglobin is 9.9 gram per DL. Her mother telling that she has delayed falling of cord after 28 days. Her mother also tells that she has a rare blood group, that is Bombay blood group. She has a history of early fallen of primary teeth and recurrent skin infection. So what may be your diagnosis? The options are LAD1, LAD2, AML type 3, AML type M3 or HLH. In this question, we are seeing that the child is suffering from pneumonia many times. That means the child having suffering from recurrent pneumonia and also recurrent skin ulcer. That means there is a recurrent infection occurs in this child and the WBC count is also high, and there is a typical history of delayed cord fall more than 28 days, and there is a rare blood group of this child, that is Bombay blood group, and there is early fall of primary teeth. That means the child is suffering from some primary immunodeficiency, and this is a typical history of a patient who is suffering from LAD2 deficiency. So what do you mean by LAD2? So what do you mean by leukocyte adhesion deficiency? As the name suggests, leukocyte adhesion deficiency means the leukocyte cannot adhere with the endothelium. Mainly the neutrophil is adhered to the endothelium cells when there is a inflammation. That means when virus bacteria enter into your body, then this virus bacteria engulfed by the macrophage, and the macrophage produce some cytokines, and these cytokines affect the nearest endothelium, and the endothelium produce some receptors in the cells, and these interleukins and cytokines is attached to the neutrophil, and the neutrophil is get attached to the endothelium cells, and then there is a transmigration of the neutrophil from the blood vessels, and this neutrophil enter into the extracellular space, and then there is a chemostaxis, and this neutrophil then engulf and enter to the site of infection, and then neutrophil acts by some method and they kill the bacterium. In case of leukocyte adhesion deficiency, the neutrophil cannot get attached with the endothelium layer, and then it cannot enter into the extracellular space and cannot get attached and comes to the infection site, and then that's why the virus bacteria cannot kill by the neutrophil. So in normal physiologically, in normal patient, the neutrophil, when the bacteria enter into your body, the macrophage take the bacteria and they produce some cytokines, and these cytokines first get attached to the endothelium, and they also stimulate some production of some interleukins and some product that take the neutrophil to come to the endothelium, attached to the endothelium. Firstly, there is a physiological rolling. That means the neutrophil attached to the endothelium layer, and then there is a rolling of the neutrophil. When there is infection, the endothelium produces some selectin by the cytokines, and this selectin get attached with the neutrophil receptor, and then there is a adhesion. That means the neutrophil get attached with the endothelium by the integrin protein. So selectin is for the rolling and integrin protein is for the adherence. Adherence means that the neutrophil is binds with the integrin and they attached with the blood vessels. And after that there is a transmigration. That means this neutrophil, when they get stimulated by the cytokines, that means the cytokines produce makes the neutrophil to transmigrate, মানে come across the endothelium and enter to the extracellular space, and then there is a chemotaxis by the cytokines, and then the neutrophil enter to the infectious site and they cause apoptosis and kill the bacteria. So this is the normal pathway by which neutrophil kill the bacteria. But in leukocyte adhesion disorder, due to some deficiency of selectin protein or integrin protein, there is no adhesion or no rolling of the neutrophil with the endothelium, and that's why there is a neutrophil present in the blood vessels, but it cannot goes into the extra cellular space, and they cannot kill the bacteria. So there are different types of LAD. We have divided LAD into three types: type 1, type 2, and type 3. In type 1 LAD deficiency, there is a problem in the adherence. That means the neutrophil cannot attach with the endothelium. In type 2, there is a problem in the rolling. That means the slow rolling cannot be occurred in type 2. That means the neutrophil cannot attach with the endothelium and there is no rolling occurs. As the rolling cannot occur, that means the neutrophil cannot adhere with the endothelium and there is no transmigration of the neutrophil. In case of LAD3, there is problem is in the adherence also. So what are the different types of LAD? As I discussed, LAD is divided into three types: type 1, type 2, and type 3. These all are autosomal recessive disorders, and the affected protein for the LAD1 is beta 2 integrin. As I say, integrin is for the rolling. As I say, the integrin is for the tight adherence. So there is a functional defect of the adherence, and there is a history of delayed cord separation. As the cord is separated by eosinophil and neutrophil, which is enter into the extracellular space, and this causing physiological separation of the cord. As the neutrophils cannot enter into the extracellular space, the cord is cannot separated by normally. There is problem in the Sial Lewis X protein. This is mainly present in the surface of the neutrophil. That means neutrophil surface there is a presence of Sial Lewis X receptor and protein, which is get added and attached with the cell selectin. As there is a problem in the this protein, there is a no rolling is occurred in LAD2. There is also history of delayed cord separation, and there is a typical features is Bombay blood group is found in this patient, and dysmorphic faces is also seen. In lactate deficiency, there is a problem in the ICAM. What do you mean by ICAM? ICAM is a protein which is present in the endothelial surface. It is present mainly in the endothelium surface, and this ICAM is stimulated by the cytokines, which is present after the attachment of the viruses with the macrophages. When the virus and macrophages get activated, then the macrophage produces some cytokines which stimulate the ICAM to come into the surface of the endothelium. This ICAM is get attached to the cell, to the neutrophil, and causes adhesion. There is also delayed cord separation, and there is a typical history of Glasman thrombosthenia and bleeding disorder. That means there is also problem in the platelet function also. And these all three LAD deficiencies is diagnosed by doing the flow cytometry. So what is the clinical features of LAD? In LAD deficiency, there is a typical sign of inflammation is absent. That means the swelling, erythema, and warmth is absent in LAD deficiency, and there is absence of pus formation. As because the neutrophil cannot enter into the infectious site, so that's why there is no pus formation. The child is suffering from recurrent skin infection, recurrent infection by the virus bacteria in the respiratory tract or in the genital tract or in the mouth. The child having multiple episode of gingivitis. There is a history of delayed cord separation, and there is a history of also omphalitis. The presence of omphalitis with delayed cord separation is distinguishes this disease from normal healthy infants. In healthy infants, 10% healthy infants, there is also history of delayed cord separation after 21 days. The skin infection may progress to large chronic ulcer, and the ulcer heals slowly and need months of antibiotic. There is severe gingivitis, and that's why there is early loss of primary and secondary teeth also. Now, what is the treatment of choice? The treatment of choice is hemopoietic stem cell transplantation. If you found any patient having multiple episode of pneumonia with high neutrophil count, that means neutrophil count is more than 1 lakh during the infection and more than 15,000 in between the infection, and the child having history of delayed cord separation or gingivitis or multiple chronic skin ulcers, then think about leukocyte adhesive disorders. Thank you.